Thank you, Madam President. I rise in support of SB 159, which I think may be one of the most important bills that we're going to be entertaining this session. The bill increases accessibility to preventative health care to fight the spread of HIV and AIDS. In addition, it removes barriers for sexual assault victims seeking timely access to PrEP by allowing pharmacists to provide the HIV pre-exposure prophylaxis to PrEP and post-exposure prophylaxis PEP to patients. It's not a mere myth, but a simple fact that increasing access to preventative health care greatly fights the spread of HIV and AIDS. So basically what this bill does is two things. It allows for greater accessibility for patients that need the acute treatment of PrEP by going to one of 5,000 pharmacies that choose to participate in the state of California. And two, it stops the prior authorization process that sometimes can drag on for days. But it's very important, if these drugs are going to work, they have to be taken in a very timely way. That's less than 72 hours, or the drugs simply do not work. When I was working for my Doctor of Pharmacy degree at USC, I actually did rounds with physicians at the County USC Hospital. We often took many of the same classes together, with medical students such as anatomy, histology, physiology, pharmacology, biomedicinal chemistry. And it's not a unique idea that pharmacists are able to administer medications. In fact, as most of you know, you can get immunized at just about any pharmacy in the state of California that has pharmacists that are specially trained to do so. And with that, we have increased the herd immunization rate, protecting our communities. And at the end of the day, with the passage of SB 493, we codified into law that pharmacists are bona fide health care providers. Thus, we play a critical role in the delivery of health care for patients. As I mentioned, there's over 5,000 pharmacies in the state of California, and many, especially some of these chain stores, are open 24 hours a day. So if there is an emergent need for PrEP or PEP, a patient can get those drugs easily and in a timely way. Let's face it, one doesn't always plan acts of passion. Sometimes things just happen. But if you need PrEP or PEP, and you need to go through a doctor to get it today, and you need to go through the prior authorization process, chances are you may not get to the infection in time where it actually becomes an active infection. Beyond 72 hours delays the effectiveness of these drugs, where they just don't work. Let's leave it up to the individuals that know what they are going through and know that they will need to get medications to prevent their health from deteriorating. We have proof that pharmacists can take on more professional roles like prescribing and giving immunizations, and we should be looking for ways to expand their professional roles to prevent more cases of AIDS. We need to eliminate AIDS just like we eliminated polio. We have the drugs available, and they are safe and they are effective. But simply, people just don't have access. As the senator from San Francisco mentioned, the uptake of these drugs, unfortunately, is low, much lower than we would like. And again, it goes back to accessibility and timely approvals of these drugs. With the appropriate protocols and increased accessibility, especially in areas of color, where we see a high percentage and preponderance of AIDS attributed to the fact that these individuals don't know that these preventative drugs are readily available. We could greatly reduce the morbidity and long-term sentence of patients that will come down with the AIDS virus. This bill not only could save a life, but could also give hope to those who are at risk of getting HIV and AIDS. Thank you to my colleague from San Francisco for your leadership on this issue. In the best interest of the health and safety of all of our residents in the state of California, I wholly support SB 159 and encourage your aye vote.